name is Leila Kheradpir. I'm one of the program managers at StarFish Medical. When designing a successful and high-performing project team, I like to look at the technical expertise needed in a project team, but also I like to look at the soft skills and see how a team can gel together and how it can perform and collaborate internally. At the end of the day, we're trying to have a team that can excel and deliver the project goals and bring internal success for the team members as well as for our clients. So looking at the expertise, it's a common selection approach for any successful team. But we need to look at the soft skills, our superpowers. We need to look at problem-solving skills, communication skills. At the end of the day, we need a team that's working cohesively together. As a project manager, I'm always observant. I look at my team, I look at the team dynamic. I use tools such as surveys, questionnaires throughout the life of a project to measure the health of the team, not only the health of the project. With the health of a project, we'll often look at timeline, we'll look at the quality of the outputs, we'll look at the budget. But we need to look at the health of the team members. As a project manager, I like to look at and observe the team. I like to ask questions to find out how the team members feel about their goals, how they feel they contribute to the objectives of the project, and then how do they feel about the other stakeholders, and how do they feel about the other team members in terms of accountability. I don't stop there. I like to have one-on-ones with the team members. I make observations, I look at the team dynamic, I look at body language. Along the way, I also identify successes and try to have lessons learned for the future team collaborations. To learn more, please check out our website for project management blogs.